Right now, 2/3 of rural Wisconsinites have to travel 30 minutes or more to get emergency care.
But Wisconsin is asking the federal government for $1 billion to improve rural health care. Our Elly Laliberte joins us now. And Elly, how would this money be used?
Well, Eric, Sarah, the Wisconsin Department of Health Services released three main priorities for this money. $337 million would go to recruiting and retaining a workforce. $329 million would go to technology and innovation, and $279 million to strengthening rural care partnerships. But it could be a while before hospitals in the state see this money.
So maps are a big part of what we do.
John Ike is the director of Wisconsin's Office of Rural Health, an organization that helped the State Department of Health Services draft this proposal for $1 billion to improve rural health care. The $1 billion is part of the federal Rural Health Transformation Program, a $50 billion fund born out of President Trump's so-called Big Beautiful Bill that was signed into law this past summer. The purpose of the fund is partly to help address concerns over Medicaid cuts that also came with that legislation.
Those cuts were large and devastating. At the same time, in the same bill, they added this money into let's improve the structures, let's make things more efficient.
Although Ike welcomes innovation, he also worries about how the money would be implemented.
If you have programs of this scale, you're going to want to ease your way into it. We're not really given the time to do that.
It's a concern shared by the president of the Wisconsin Hospital Association.
It provides a lot of opportunities to invest in areas like workforce and education and technology where maybe providers didn't have the resources to be able to do that. The one caution, of course, is that anytime that you invest in healthcare services, you need to make sure that you're sustainable and ongoing.
Ike says although DHS is talking with stakeholders, the amount of projects and initiatives in this proposal are extensive and need time to be fleshed out.
The federal government sometimes will want to solve a big problem very quickly. And so what they do is throw a lot of money at something. But again, I think strategically, that's not the best way to do it.
Now, DHS is planning on recruiting a team solely to manage this project. However, it won't find out if it receives the money requested until the Centers for Medicare and Medicaid announce awardee decisions at the end of the year.
Okay, thank you, Elly.